garages of potential donors are refraining from coming to work, they're staying home, and they're not going to church. We are very concerned that these necessary activities will have serious and life-threatening impacts on the blood supply unless our community acts now. The shortage is a national emergency with the U.S. Food and Drug Administration making an urgent appeal on Thursday to the public to donate blood. The FDA reiterated that there have been no reported or suspected cases of transfusion-transmitted coronavirus and that the virus poses no known risk to patients receiving blood. Therefore, we are asking public officials to designate blood donation as an essential activity and to include the need for giving blood in all of their messaging in the days ahead. We are also asking the public to respond by giving blood. Our current blood inventory is at about a 2.5 day supply. Under normal circumstances, I would not be overly concerned because we maintain a steady calendar of blood drives and donors. However, in the last 3 days, we have seen 1,600 units drop off of our calendars as 50 blood drives have canceled, and in the days ahead, I expect to see more of the same type of activity. To be clear, every day patients need blood. These blood drive cancellations mean that in very short order, blood inventories locally and nationally will be depleted. As a community, we can't let this happen. We have taken or are in the process of taking the following actions. We've directly notified all of our hospital partners of this situation, and we have asked that they evaluate their inventory levels and closely monitor usage. As of today, no rationing has occurred. However, should the decline in donations and blood drive cancellations continue, we will be conferring directly with our hospital partners about canceling elective surgeries and rationing blood for use only in the most extreme cases. Currently, we are not capable of helping other parts of Texas or the U.S. for emergency requests for blood. And our blood center partners are very limited in their ability to help us. We are taking every effort to build a substantial blood supply. Giving blood is an essential and safe to make sure our donor rooms are a safe and healthy environment. We have instituted extra cleaning measures to limit potential exposure to our donors and our team members, and we are taking temperatures on all donors and employees and visitors as they enter our donor rooms. We have already increased our donor recruitment efforts and recognition items to schedule and encourage more donations at our fixed sites. I am personally asking our South Texas community to answer our calls and our texts and to schedule an appointment. If your company has a blood drive, we ask that you do not cancel it. And if your organization has already canceled their blood drive, community or work activities, please contact us to set up blood drives at one of our fixed sites. We are also in the process of expanding hours and days of operation at all of our fixed sites. We are asking all of our donors to make appointments as we begin to limit walk-ins. We are taking this action to help provide social distancing for our donors. Because of our Brothers in Arms program, we have whole blood available for pre-hospital and mass transfusion events. We will be expanding our recruitment efforts to build a substantial inventory of whole blood. We are also rapidly implementing cold stored platelets. Cold stored platelets have a shelf life of 14 days, and these platelets are intended for active bleeding when conventional platelets are unavailable or in very short supply. These platelets were recently approved by the FDA and will be most helpful in the days ahead. In closing my remarks, I'd like to say again thank you for all of you being here with us today. This is a different situation than we have experienced in the past with emergency appeals. This is a national crisis, and it's important for all of us to be carrying the message to our families and our friends and our organizations that giving blood now is imperative as we see the bloom of the virus throughout the United States. At this time, I would like to welcome Dr. Leslie Dr. Leslie Grebon from University Health System. She is the Medical Director of Transfusion Services to speak about the impact on University Hospital and its patients. Dr. Grebon.
Hello, good morning. I'm Leslie Grebon. As said, I am the Medical Director at University Hospital Blood Bank, and I just wanted to speak to you about our center's blood needs. So we are a level 1 trauma center. We also are a referral center for maternal morbidity and mortality for patients that have abnormal and extreme risk of bleeding during childbirth. We also support transplant and hematology, oncology, and other patient populations as well. However, we have a lot of patients that have a lot of use for large amounts of blood and a critical need for blood at an emergent time. So therefore, what we're trying to do, because we know that there is going to be increased risk of use of blood, potentially, and we will not have the available inventory that we usually rely on, we're trying to proactively go ahead and monitor our transfusion rate. We have told our physicians already to be mindful of our resources because we want to make sure that we have enough in case we start to go into a critical shortage. Our patient population, again, relies on immediate blood use for our trauma patients, and so we're trying to limit transfusions within our hospital already. We're already trying to take considerations of who is critical and what kind of surgeries may be possible to be held off until somebody that has a more urgent need and life-saving need could be considered. So I have no other further comments unless there's direct questions. Thanks.
Thank you, Dr. Grebon. Next, we've asked Dr. Joyce Schwartz, who is the Director of Clinical Pathology and the Medical Director of the Blood Bank for the Methodist Hospital, to please come and provide us a few comments on how the situation will impact Methodist Hospital.
Thank you for asking me here today. I want to assure you there is no substitute for blood, whether it's for a surgical procedure or a medical condition. One day either you or your family member or your friend will need blood to save their life. The South Texas Blood and Tissue Center is urgently in need of blood. These shortages may particularly affect the patients we see for cancer treatment or for bone marrow transplants or for other transplants at the Methodist hospitals. I know some of you may be anxious about giving blood and donating blood because of the coronavirus, but believe me, it is safe to donate blood. If there is a blood drive in your area, I strongly encourage you to donate. Blood drives are where caring, healthy people go to help other people in need. Thank you so much.
Thank you, Dr. Schwartz. Next, I've asked Dr. Samantha Gomez, the Associate Medical Director for the South Texas Blood and Tissue Center, to come and talk about the safety of the blood supply and also how this particular situation is going to impact our ability to collect blood.
Thank you. So donating blood is safe. We're taking every precaution to ensure the safety and health of our donor environment. Some precautions that we put in place include sanitizing the donor bed and screening room following donation. We're also doing temp checks of all of our employees as they come in to work. Additionally, we're asking donors who've been exposed to coronavirus to please self-defer. And so before each donation, we also ask donors, are you feeling well and healthy today? We also perform a mini physical, which includes a temperature check. So healthy people donate blood, and it's imperative the community steps up to donate blood to ensure we have enough blood for our patients that need it. And donors are not at risk of getting coronavirus from donating blood. Donating blood is safe, and there are also no reports of transfusion-transmitted coronavirus. So if you're healthy, please come in and donate and help save a life. Thank you.
Thank you, Dr. Gomez. Next, we have Richard Pettis, who is the President and Chief Executive Officer of the San Antonio Chamber of Commerce and also a blood donor. and a Brothers in Arms donor. Yes, yes. So come on up, Richard.
Thanks,
Thank you.
How are you?
I'm good.
Good to see you.
Good to see you too.
Thank you, Elizabeth, and good morning, everyone. I am here today on behalf of the San Antonio business community to ask for our San Antonio business community to get involved. As we always do, the business community always steps up and provides blood drives and the opportunity for people to donate. Of course, now that we're in the midst of the emergency declaration and all the things that are happening, our work schedules are changed. They're different. But there's still an opportunity for us to come in to the various donor sites that we have. There's 5 in San Antonio. They're safe, as you've just heard. You'll get your temperature checked as soon as you come in. You'll get a mini health screening to make sure that you're able to donate. And the donation that you provide will save lives. It is very clear. It's very straightforward. And so I'm asking people right now in this midst of what we're doing, you know, all of us feel a little helpless. We feel a little like we can't get involved, but we can. And this is probably the best way that we can help and change people's attitudes and give them a purpose and help us make the blood supply available so that we can continue to save lives in our hospitals and in emergencies. Thank you.
Thank you, Richard. And finally, today I'd like to introduce our mayor, Ron Nurenberg. I'm really delighted that Maren Nurenberg, I know that you're extremely busy right now and there's so many things that are going on, but your awareness that this could be a potential public disaster is really appreciated, and coming here today and sharing a few words with us is very, very important. So, Mayor, would you please come to the podium with your remarks. And Maren Nurenberg is also a blood donor, and he's going to take time to donate blood today, so thank you for that as well.
Thank you. Thank you. Good morning, everyone. I first want to recognize and thank my colleague, our Public Health Committee Chair, Councilmember Anna Sandoval, for being here as well. We're both going to get stuck today and donate shortly after this. But yesterday, the City of San Antonio, we declared a public health emergency in order to give us the best preventative measures to prevent a crisis in our community that we've seen in other parts of the world with regard to the coronavirus outbreak. We are putting our medical professionals, our community in general, in the best possible position to ensure the safety of our residents. In doing so, we also recognize that we have to prevent disasters from occurring with regard to the medical community. So this entire effort and this call to action is about ensuring that one of the essential functions of our medical system, being able to donate blood and being able to receive blood if you're in need, continues. And as you've heard, we've had a shortage issue arise because of the concern about coronavirus. We want to dispel the myths. Number one, coronavirus is not transmitted through the bloodstream. Number two, people walking in to give blood will be screened. It is a safe process. And number three, it's probably one of there are fewer, better ways to help our community in need, to help your fellow neighbor, than giving blood. So we're asking you, if you have canceled a blood drive, please consider rescheduling it. If you are willing to make an appointment, blood donations now, you just call up and they will schedule you in to make sure that we have the proper social distancing during the blood donations. But we need to do this ASAP. Just like you are considering your own work schedules and making sure you're taking care of your children during the turbulence of the next few weeks, we also need you to consider your neighbors in need who are maybe waiting for a surgery, maybe they're about to deliver and are pregnant, maybe they are needing a blood transfusion. Your actions now really matter and can save lives. So today we're also designating blood donation as an essential city function. And so that will be to ensure that blood donations can continue here in the city of San Antonio unabated as we work through the rest of this public health emergency. Thank you all for being part of this effort. I do want to say thank you to all of our neighbors who have responded so well. We are in a good position to prevent the worst of this outbreak because people have been working in concert, coordinating with one another to ensure that San Antonio is in a good place. So I'm going to hand it over now to Councilmember Sandoval to make a few remarks as well.
Thank you, Mayor. I have to be honest with you, on my way here today, I was hoping to donate blood, and then I saw there was a press conference, so I'm delighted that the message is getting out there. I think I just want to echo what the Mayor has said. There's a lot of need in many different ways. Ever since the emergency declaration was made, you know, just yesterday we were in the office worried about childcare, worried about food security, and this is one of those other potential vulnerabilities that we will have when we're facing this public health emergency. And it's wonderful to see all the different sectors and groups come together and make a push for this. It's funny, some of you are in multiple sectors, and I see you everywhere sounding the emergency and the need for help. So I will be giving blood today. I encourage all of you to do so. I know some of us have nothing but time right now, so it is a great time to donate blood. Thank you.
Thank you, Mayor and Councilwoman. I truly appreciate you taking the time, first of all, to be a blood donor. And I've been in this business for a long, long time, and I've never seen anything like this. And so to have community leaders that are putting this as a primary initiative for our community during a very difficult time speaks volumes of for your leadership, and I truly appreciate it. Second of all, designating giving blood as an essential function for our community so that the word will get out in a way that will make sure that we don't have the crisis that we're anticipating. I think it's going to make a huge difference. So thank you for making that designation for us. As we move forward in the days ahead, as I close up the conference here, as we move forward in the days ahead, once again, I personally, as a blood donor and as someone whose family has received many, many units of blood over the years, I'm asking all of the healthy people in our 48 county area, South Texas, and up into Lubbock. We actually serve the Level 1 Trauma Center in Lubbock, Texas, that you take the time to donate blood. No matter where you are, you can reach out to a blood provider, either here, use us, or if you're in another part of the country, reach out to your local blood provider. Blood is needed everywhere today, and in a way that we've never seen in the past. If you have any questions about how your blood donation will make a difference, please go to our website, southtexasblood.org. You'll have all the information about how you can make a blood donation, about the things that you should take into consideration before you come and make the blood donation, and of course to make that valuable appointment. Are there any questions for me?
What's the normal stock that you have in place for blood banks?
We like to maintain a 3 to 5 day supply of blood, and that is for every blood type and for every blood product. Currently, we're at about 2.5 days. And as I said, that normally wouldn't give me a lot of concern because I can look on the calendar and see that there's many blood drives that are scheduled, and I know that there's donors that are associated with those blood drives. But as we see enormous amounts of blood drives cancel and the blood donors that are associated with that, it makes me very, very concerned. Fortunately, we are seeing blood donors come into our fixed sites at above average rates, but that's still not enough to curtail what we've lost from the blood drives that have canceled.
How many have canceled so far?
We've had about 50 cancels so far. That was as of 5 p.m. last night. And that was in 3 days that we had 50 cancel. Yes?
Is there a certain type of blood that maybe you will need more of at this time?
Thank you for asking that question. We generally are in short supply of type O negative. Type O negative is the universal blood donor, and it can be given to anybody regardless of their blood type. Right now we have about 1.5 days supply of type O negative. We would like to have much more than that. When we think about the stock levels, if we weren't in the midst of this pandemic situation and we're trying to flatten the curve, so to speak, then I would say having a 3 to 5 day supply would be adequate. But we're looking at days and weeks ahead where more people will be working from home, and we may even see people have the coronavirus and become ill, and they will essentially jeopardize other people, healthy people. So we need to build our stock levels to be 10, 15, 20 days worth of blood, not just 3 to 5 days. That's what we're really asking, is to build enormous stock levels of blood, not just adequate for our 3 to 5 day usage.
And I know you said that, I guess, in will you all kind of become worried? And if it does get to that point, what options will you all have at that point?
So to be clear, I am worried right now. If it was normal business as usual, I wouldn't be worried. But because we've got all of these blood drives that are canceling, and I'm sure there's going to be more cancellations, I am very worried. In fact, I don't know that I've ever been this worried in my career. So that's why we're having this press conference, because we need to get the message out in a way and at a level of emphasis that you wouldn't normally see coming out of a blood bank. So, great question. Yes, ma'am.
Is there a protocol, or does there need to be a protocol if someone has given blood and then a few days later they have coronavirus?
So if someone donates blood, regardless of what the reason is, if they feel unwell after they donate, that we have a hotline for them to call so that they can tell us that they're not feeling well and what the symptoms are, so that we can recall those units and make sure that they don't make them out to the hospital. And we tell all of our donors that after they donate. Any other questions?
When people do call to cancel their event, are you expressing that concern to them over the phone? Really wish you wouldn't.
Absolutely. Absolutely. And the organizations that are canceling the events, I believe that they're thoughtfully doing that and trying to protect their employees or their constituents or their community members. The importance of saying that blood is an essential activity helps raise that level of awareness that while you're canceling this blood drive, please help us amass that group of donors and have them donate someplace else. Don't just cancel the blood drive. Let's get those donors to go either up to Chavano or to New Braunfels or to here to DP or in Victoria. Let's see if we can get them to donate someplace else.
You said you have 5 locations in San Antonio. Do you have that?
We have 5 locations in San Antonio. We also have one in New Braunfels, and we have one in Victoria. And if you'd like a list of those, they're actually on our website, or we can get that to you before you leave today with all the addresses and phone numbers and contact information.
When you all go through situations like this, right, where there is a need for blood, do you all tend to look to employees and staff members to try to at least kind of get that number up a little bit, or how does that kind of work?
So we actually have a blood drive going right now with our employees, and but we have 700 employees, a little over 700 employees total, and we use 400 a day. 400 donations a day are required. So that would essentially suck up all those donations in a day if they could all donate, and they can't. Not everybody can donate. But even if half of us donated, that would only be a one-day supply. So we really do need a community engagement, and we need for it to be large. Because as I said, we're not looking to build up to a 3 to 5 day supply. We're looking at 15, 20 day supply, because we don't want a single patient to have to wait or feel like, I don't know if I'm going to be able to make it another day because I don't get the blood that I need today. And that's what I'm really concerned about. I'm also concerned, and I'm sure our physicians are as well, is that when it gets down to it, does this patient get the blood or does this patient get the blood? And in the United States of America, that should not have to be a choice. That should not have to be a decision that a physician should have to make, if this person gets blood or this person gets blood. We've got hundreds of millions of people who live in this, so I'll get on my soapbox a little bit. We have hundreds of millions of people who live in the United States and want something to do. They want to be helpful. Giving blood, an hour of your time, good grief, like we're going home and, we've got all kinds of spare time now. Come into your donor center, whether you're here in San Antonio or anywhere else in Texas or anywhere else in the United States. There is a blood center that needs your unit of blood today, tomorrow, and the next day as we work through this crisis. So that's my soapbox. Not passionate about it at all, can you tell? Anything else for me?
Will you one more time just talk about those extra cleaning measures you guys are taking?
Certainly. So actually, almost a month ago, as we were looking at the potential effects of the coronavirus, we implemented our corporate contingency plan, where we look at what do we need to do in order to maintain a safe and healthy environment for our staff and be ready for the emergencies as they come forward. So first of all, we started extra cleaning measures. So we have cleaning crews that essentially every 2 hours are going through and they're wiping down all the surfaces, all of the hard surfaces, taking out the trash, making sure that we've got as little exposure as possible. We're also asking that when people come into our building, that before they come into the building, they allow us to take their temperature. If they have a spiked temperature, they're not able to come into our building. We're also limiting the number of visitors that come into our building. I'm not talking about donors. I'm talking about vendors or people who have non-essential business in our organization. So we're doing that. We're asking additional questions. So for example, have you been to a high-risk area? And if you had, would you please self-defer for 28 days? And then if people have fevers, we're asking them that they both employees and donors, please be fever-free for at least 24 hours before you try to donate again or before you come back to work.
And I'm sorry, could you state your name and position as well one more time?
Certainly, Elizabeth Waltman, and I'm the Chief Operating Officer at South Texas Blood and Tissue Center.
Could you spell that?
Certainly, ELIZABETHWALTMAN. Anything else? Thank you again for participating in this press conference. I really appreciate it and help us get the message out. And for those of you who want to donate blood, we got a bed waiting for you. Thank you.
Yeah.